Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Welcome, everyone, to the Cracking Cancer podcast. This is a podcast dedicated to increasing awareness about all things cancer, and 100% of profits from the recordings of this podcast and all YouTube content and other social media content go to cancer research. I am your host, Dr. Kyle Concannon. I'm a physician scientist at MD Anderson Cancer Center. And with me today is Samantha Morrell.
Hi, everyone. I'm Samantha Morrell. I am based out of Utah, and I have non-small cell lung cancer, stage 4 with a HER2 mutation.
Great. Well, today we're going to be talking about chemotherapy. For most people, they think cancer, and one of the first things that comes to mind is chemotherapy and what chemotherapy might mean. And for me, at least in clinic, chemotherapy is one of these topics where people come in with a conception of what chemotherapy is. And it's like one of those things where, like, the person that you've seen like a million times in the hallway and you never knew their name, and now you've known them for too long, you like feel uncomfortable asking. Everyone feels like they should know what chemotherapy is, but most people, or many people don't really know how chemotherapy works and what to expect with chemo. So hopefully we can shed some light on that today and alleviate some anxieties and get the knowledge level up. So any conversations with your provider or your medical team can be really productive and talk about details rather than what chemotherapy is and its function. You know, Samantha, I know you were a patient who had chemo and have regularly had chemo. What were some of the conceptions that you had when you were first kind of hit with that realization that you were going to be someone on chemotherapy?
Yeah, so my mom and I's response was the same. Because we knew specifically with the lung cancer type that I had that there could be variable options out there on what avenue I took. And the traditional chemotherapy route honestly scared us. It was a very scary concept, and I automatically associate chemotherapy with like toxicity and like infiltrating good and bad cells. And so you're essentially like just flushing your body with this toxic substance that may or may not work. And so that was kind of my concept of chemotherapy. I also defaulted to like, I'm going to lose my hair. It's going to be an horrific experience. This was before anyone like explained anything to me. And I just thought it was going to be the super toxic thing. It's going to be awful for every aspect of my body. I'm going to be bedridden, and it's going to be the most unpleasant experience I've ever gone through.
Yeah. And when you were reading up on chemotherapy, or, you know, before you had your initial visit to get an infusion, like what were some of the things you were seeing in the community about either people's experiences? Like, what are the conceptions that are out there?
I think the very, very first conception, I think for some reason, wild reason, is hair loss. And I don't know why this is like such a defaulted thing. And I often get told, you know, oh, when I tell someone I'm a cancer patient and being treated, they're like, but you have hair. And so like, it seems to be the number one thing where it's like chemotherapy equals hair loss. So I was definitely reading a lot about that because I didn't know necessarily at the time what chemotherapy I was doing. And, you know, some chemos you lose your hair, others you don't. I was reading a lot about hair loss, and then just a lot about like just general sickness. You know, this is going to put me in bed. This is going to make me nauseous, extremely fatigued. I personally was reading a lot about people losing a lot of weight, and I am already a very small person, and I knew how important it was to be of a good weight through my cancer treatment. I think there's some statistic that you're gonna live longer potentially if you have more weight on you because of treatment and weight loss. And so like I was reading a lot about weight loss and how much weight people had lost, and that honestly terrified me and my mom as well when we were reading it, because it's like I don't have that weight to lose.
Yeah.
um, so there was that, and then again, like I said, just about the toxicity of people being like, this is bad, chemo is bad, and maybe don't do chemo, try XYZ instead, like chemo is bad. And so there's a very big misconception about it. And, you know, I'll fast forward a little bit for this statement, but like, I am now very much an advocate about chemo and how impactful it can be in a good way as part of your care. And so like when people now say chemo's bad, you shouldn't do chemo, I'm like, well, actually it was pretty darn good for me and it did some amazing things in my body. So like let's give it a moment and like trust the process here. So yeah, that was fast forwarding, but backtracking. Yeah, there were a lot of unknowns and a lot of misconceptions for sure, especially as I didn't know what chemo I was on.
Yeah. Yeah. And there are so many, to your point, there are so many different types of chemo, but fundamentally you're putting a toxin in your body, like they
Mm-hmm.
are toxins, they
Yep.
are poisons.
Yep.
And this idea that we're gonna poison your body and hope that it hurts the cancer more than it hurts you
Yeah,
is it's a tough sell.
it
It's
is.
it's not an
Uh,
easy thing to convince someone's a good idea.
Especially for me, my entire life, I have been that person that won't even like take an ibuprofen if I have a little bit of pain. And so the thought of such a pristine body, so to speak, that has not been touched by many medicines at all, suddenly being infiltrated with chemotherapy, it was like, okay, well, this is either going to go over really well or really badly because my body's going to be in shock.
Yeah. Well, and when you were looking through this before you started, what was your idea of how it worked, or what is a common conception for how this stuff works? What do you think people know?
That's a great idea. A great question. Sorry. I'm a very visual person and I like to like visualize the actual action of the drug, doing what it's supposed to do in the body. And I had no idea. Like I couldn't even imagine it up in my mind about what it was doing. I actually defaulted to just imagining piranhas in my body eating up my cancer because that image was essentially what I latched onto because I didn't understand the science whatsoever, other than like it's flushing bad cells. But like, what does that mean and how does it work? I had no idea.
I could see how the piranha image was a challenging one to reconcile. Yeah, that doesn't sound really reassuring. I wouldn't love the palpitations I'd have sitting in the seat for that.
Right.
Um, yeah, and what was the conversation that your oncologist had with you when you were being described what chemotherapy is? Like, what's your understanding now?
I didn't really have much of an explanation, to be honest with you, just that this is the drug you were going to be taking. And I was given a booklet with just generic side effects of chemotherapy and what to look out for. So I wasn't really told in great detail how it works. And I don't necessarily know if everyone necessarily wants to know. I, at the time, was so overwhelmed with my diagnosis, I don't think I could have taken that education on board at the time. But like now I'm super interested. And if there had been information out there ahead of going into my treatments on how it worked, I think I would feel more informed and less scared.
Yeah. Yeah, and I think that's a big provider to provider difference as to how much information you give at once. How much
Yep.
can a given person really take in? Because things you want things to move quickly. Like you want
Right.
someone to be informed, but you don't want to be overwhelming, and you don't want to delay.
Yep.
So yeah, for the patients who are interested in hearing more and want to know that kind of mechanistic detail, what I tend to tell them generally about how chemotherapy works is that, to your point, it is a toxin. We're putting in a poison into the bloodstream that attacks cells that are dividing. Your whole body is made up of these individual cells. And then in order for a cancer to grow, a malignant cell or a cell that has become a cancer has to go from one cell to two cells. And then it goes from two cells to four cells and four to eight and so on. And that process of a cell dividing and going from one cell to two cells is something that we can target with chemotherapy. And these are things like how your cells are going to replicate all the DNA, how they're going to undergo that process of splitting from one cell into two cells, those kinds of things. And since cancer needs to do that in order to grow, that's a really good way to target it. Unfortunately, your tumor cells, once tumor cells, are not the only things in the body that are doing that. Because the chemotherapy doesn't care. Chemotherapy goes wherever it goes. So there are skin cells do this, cells in the GI tract do this. There's a lot of areas in the body that are rapidly dividing and turning over and replenishing themselves. And the cancer is going to attack them too.
Mm-hmm.
But, where that chemotherapy is going to be most effective is going to be the tumor cell, because the tumor cell is the thing that's dividing the most.
Gotcha.
And that's what we see in the scans usually. When someone has a good response, their tumor goes all the way down or may have a really good response, but it's not like your skin totally sloughs off. It's not like your GI tract is, disintegrated. So the cost benefit, even though it is a toxin, we've learned works. And over time, how to titrate that cost benefit has gotten a lot better. Back in the day, they were giving the highest doses one could give. Like they were just cranking it up and until it wasn't tolerable anymore. And we found out you don't really need to do that. So lower doses are often just as good as the super, super high doses. Although there are certainly some cancers that need the higher doses. But it's different for every tumor. The mechanisms are the same, but how much of those mechanisms, how strong you are on the gas pedal, does change from tumor to tumor. So when someone sees someone's side effects, keep in mind, like that may not be you.
Yep.
Yeah, every tumor is different. Breast cancer treatment is different from lung cancer treatment, different from colon cancer treatment. So I think mechanisms are all the same, but how hard you're put on the gas pedal. That's kind of how I tell patients. Fortunately, since I mostly treat lung cancer, most of those patients don't lose their hair, and I get to do some reassurance about side effects. But we can get into that in a little bit. So yeah, the thing I'm next interested about, like when you were getting ready and you were told you were going to get chemo, what was that experience like? Literally going to your first chemotherapy infusion, like you're told, here's your regimen, XYZ, and like you look that up, but you don't know what that's going to be like. What were your expectations? What was that day like?
I had no expectations because I had no idea what was going on other than this is the block of the appointment and this is how long it's going to take. And I started off with blood work. So what they usually do, whether it be a few days before or the same day, they'll check your blood work, right? And tell me if I'm saying things wrong because you know more than me. But they check the blood work to ensure that you're in a state that can accept the chemo, I guess. So they took all my blood, looked at different levels of my blood to make sure it was okay and functioning okay. And then I was taken up to what's called the infusion room, and they called me back, and I'd already had something put in my arm from the blood draw. So I was just kind of walking around with this thing in my arm, and sat in the infusion chair, and they said, we're going to give you some pre-meds to make sure you don't necessarily have a bad reaction to this thing that you've never had before. And I'm like, that's reassuring. And they made me take, for my chemo specifically, a steroid a day before and the day of to also, I'm presuming, ensure that maybe if I did have a reaction, it wasn't as bad with that steroid. But yeah, they gave me a ton of nausea meds through my IV that were just like, these meds last for 3 days. They'll help with your recovery through the chemotherapy. And yeah, and they said, here we go. And they said, this chemotherapy is going to take, I can't remember the length of time. I think it was an hour. I had 2 chemotherapies. So I think one was an hour and one was 10 minutes. Where they just started to administer the chemos, and the nurse like sat with me to ensure that there were no like crazy reactions, because some people can, I've been told, have some pretty gnarly reactions. And my mom was there holding my hand, and my husband, and we were all crying. and the reason why we were all crying is just like, wow, this is really happening. Because I think up to that point, and a lot of people might be able to relate to this, you're still in this sense of like non-reality of like, is this really happening? And so when you're actually in that infusion room and you're finally getting the drugs that they're saying you're going to be treated with to help your cancer, you're like, oh, this is really real. This is not a made up thing. This is real. And I'm having these drugs administered. And so, yeah, the nurse sat with me to ensure there wasn't a reaction, and there wasn't. And so the hospital I'm at, there's a massive panoramic view of the mountains. And so I was just looking at the mountains and having this chemo in my arm. And the big shock to my system, I think the most, honestly, was that infusion room was full of people over 60 years old. And so, you know, I'm 38. I certainly got a lot of stares, a lot of sympathy stares, which was almost made it worse, because it's like, wow, this is really happening. And yes, I'm so young, and I'm like the 1-2% of the people in this room that are like under 60, which was also an initial shock in itself as well.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.